Exercise intervention to aid in the reduction of disease risks. To start, let's take a look at some background details of our participant and look at some of her stats of her physical activity. The participant is a 58-year-old female who works part-time and is a part-time carer to 3 young grandchildren. Her steps per day on average reach 3,865. Research conducted by Tudor, Locke and Bassett, 2004, proposed a step-based indices chart based on data collected and indicated that our participant lives a sedentary lifestyle with less than 5,000 steps per day. She also accumulated a weekly MET count, approximately 4,450, and if we look at this figure, we can conclude that this is substantially enough to lower her risks of chronic diseases. However, accumulating more will provide considerable and substantial health benefits. Therefore, does she meet the physical activity guidelines? Yes, the participant is doing some physical activity and is active on all days of the week, however not planned, mainly unplanned activity. Yes, the participant accumulated 300 minutes of moderate intensity physical activity for the week. However, the 300 minutes was accumulated in one day by looking after the grandkids. So we need to ask, is this really meeting the guidelines of 30 minutes per day of physical activity? And lastly, the participant failed to meet the 4th requirement and does not complete any muscle strengthening activities on at least 2 days of the week. Hence, what do we need to target? 1. We need to target self-efficacy. Initiating and maintaining a habitual exercise program is an immense process, and it involves various stages: the decision to start exercising, implementing the exercise program, eventual change of the behavior, and then the successful integration of these new behaviors into the individual's lifestyle. Then, having that lifestyle maintained, and it is the last of these that perhaps presents the biggest obstacle. We also need to get her to meet the current Australian Physical Activity Guidelines, which means that she must incorporate weights into her lifestyle as well as spread out her physical activities to 30 minutes or more per day. We also need to address her sedentary behavior, and by minimizing the amount of time spent sitting or breaking up the long periods of time that she sits. Any extra increase in physical activity is going to benefit our participant. It will decrease her chances of breast cancer, cardiovascular disease, decrease cholesterol, blood pressure, and her chances of diabetes. Because she has already gone through menopause, we can only hope to maintain her bone mineral density. So let's look at some of the benefits and barriers to physical activity for women. We'll start with the benefits. By doing physical activity, dementia can be decreased by up to 30%, all-cause mortality by 30%, cardiovascular disease by up to 35%, type 2 diabetes by up to 40%, colon cancer and breast cancer from 20 to 30%, depression by up to 30%, and hip fractures by up to 68%. It is particularly important for our participant to engage in physical activity, especially because she has gone through menopause, and this is linked to increased risk factors such as cardiovascular disease, weight gain, and increases in blood pressure and insulin sensitivity. With the permission of our participant, her height and weight were taken to calculate her BMI, her height being 160 centimeters and weight of 90 kilograms, means that her BMI was over 30. 35 to be exact, and puts her into the obese category. Furthermore, physical activity has been shown to reduce weight. It also suggests that physical activity can contribute to building self-esteem and confidence, and can provide a vehicle for social integration and equality for women in society. Also, those who maintain good overall physical health have less cognitive decline relative to their age. Exercise is thought to increase cerebral blood flow and other biological processes in the brain, and has shown to improve mental functioning and alleviate mood-related problems associated with diseases. Some barriers of physical inactivity in women include that women often have a higher workload in the home and caregiving roles, for other family members, which may limit the time available for them to engage in physical activity. And this remains constant for our participant, who looks after the 3 young grandchildren for 2 days. Also, poor weather, feeling tired, negative emotions, inconvenient time of day, also stressful, having a stressful day or period, and injury. Some supporting research in the reduction of chronic disease using exercise includes adults who do not perform any resistance training lose approximately 0.46 kilograms of muscle per year from the age of 50 and above. Fisher et al. Also found that all resistance types, including free weights, resistance machines, and body weight, show potential to increase strength, with no difference between them. Reza et al. 2010 consider both aerobic and resistance exercise improves bone health in pre- and postmenopausal women. Davies et al. 2007 found fasting plasma triglycerides a decrease on the morning after a 30-minute brisk walk, either at 50% or 70% of maximal heart rate. 26 studies demonstrated both occupational and leisure time activity reduced breast cancer by about 30%. 4 hours of moderate or 3 hours of vigorous activity per week protect from both colon and breast cancer. So 800 MET minutes a week is needed for breast cancer risk reduction. Lee et al. 1999 reports that exercising at moderate intensity greater than 4 to 5 METs for 4 hours a week decreased the incidence of lung cancer. It is emphasized that 800 MET minutes a week will provide considerable health benefits, including reduced risk of cardiovascular disease, coronary heart disease, and stroke by 20 to 35%, and approximately 2 to 2.5 hours a week of moderate to vigorous physical activity will strongly decrease the risk of diabetes and metabolic syndrome by 30 to 40%. How do we increase our participants' physical activity that is specific to her needs and her schedule? Let's have a look at some of our clients' day-to-day information before we prescribe any exercise. Our client works on Tuesday and Wednesday from 6 a.m. to 7 p.m. She looks after 3 young grandkids ages 4 to 1, Thursday to Friday morning, and attends a 1-hour Pilates class on both a Wednesday evening and a Saturday morning. Having this information, how do we put together the physical activity program? We need to look at not overloading the participant and using small steps to integrate the exercise regime. If we have a look at the stages of change model we see in the pre-contemplation stage, simply by completing the experiment, the participant was more aware of her physical activity, or more so lack thereof. Straight away she was interested in changing some of her activities, but wasn't sure where to start. With information provided to the client, the pros outweighed the cons, one major restriction barrier being time. A 12-week physical activity timetable was given. It increases the client's physical activity to the recommended levels of 30 minutes or more of exercise on all days of the week and added in her weights. After the 12 weeks, we can assess if the physical activity was adhered to and if anything needs to be altered. For maintenance, we continue any goal setting for the future or introduce different types of training and other training options. The 12-week physical activity timetable is easy to use and can be put up on her fridge and needs to be filled in before commencing. All activities that are completed receive a tick, and all activities not completed receive a cross. Therefore, she can see what's working for her and what changes she needs to make, either during the 12 weeks or after the 12 weeks. This here is a simple demonstration of what the 12-week physical activity timetable can look like. The frequency is at least 30 minutes of planned physical activity every single day. The intensity is moderate. The time, 30 minutes to 60 minutes. The time of exercise can be broken up or completed at different times of the day. For example, 15 minutes in the morning and 15 minutes in the evening of the 30 minutes working on the cross trainer at home. The type of exercise varied, so the exercises include weights, Pilates, walking, cross-trainer, and looking after the young grandkids. The participant can increase any of her activity durations. For example, she can increase her weights to 45 minutes or 45 minutes on the cross-trainer instead of the 30 minutes. So what else is on offer? Here are just some activities on offer after completing the 12-week physical activity program so that she can change up her program, read about different things that she can do on a daily basis, and information on different screening for cancers. They range from Big Health, the Heart Foundation, and the Australian Government, just to name a few.